Welcome back to Black News Tonight. A big announcement comes from New York City. Workers of private sector employers will be required to get vaccinated against COVID-19 by the end of the month. Mayor Bill de Blasio announced earlier today that nearly 185,000 businesses will be required to enforce all in-person employees to be vaccinated with at least one dose by December 27th. Those employees will no longer have the option of being tested to avoid taking the vaccine. It is now a must-have, or you would be violating city law. The mandate excludes remote workers, but it also includes all children ages 5 to 11 in order to enter close contact spaces like restaurants or movie theaters. The mayor says these new mandates are necessary and vital in order to avoid another COVID outbreak and an ultimate city shutdown.
We cannot let those restrictions come back. We cannot have shutdowns here in New York City. We got to keep moving forward. And the answer, as always, is to use the things that work. Vaccination works and vaccine mandates work. That's the bottom line.
Joining me now are two esteemed political commentators, Democratic strategist and BNC political contributor Ameshia Cross, and the GOP strategist, Melik Abdul. Thank you both for joining me. Melik, I'm going to start with you. What do you think of this new mandate for the private sector in New York City?
I think a lot of people are going to have a problem with this. One of the things that I noticed earlier on is that there was a lot of discussion that we had in our community about what was happening in red states versus blue states. And a lot of that really ignored the realities on the ground when it comes to not just COVID, but the vaccine itself. And we've seen whether that was a Nicki Minaj or a Kyrie or many of the others even before then who were expressing reservations about the vaccine. And I think one of the things that went wrong early on is that we made this comparison between those who were vaccine hesitant and the anti-vax crowd. And so many of us were vaccine hesitant. And so to have Bill de Blasio doing something like this, it's not surprising, but we do know that the 1905, I believe, Massachusetts Supreme Court decision, Jacobson versus Massachusetts, is why states are able to mandate certain vaccines. So that's part of the legal framework, I imagine, that de Blasio is using here, but I expect you're going to get a lot of pushback, not just from the Black community, but communities all over New York against vaccine mandates.
Real quick, Melik, I understand you're saying that a lot of people, we should expect pushback and a lot of people are going to be upset. We know that. My question for you very quickly is, how do you think about it? Are you okay with it? Do you support it or do you oppose it?
No, I don't actually support vaccine mandates as someone who's been vaccinated myself, and I encourage other people to get vaccinated. I don't agree with the idea of vaccine mandates for this particular mandates, although there are mandates for other vaccines, just not this
one. Madam Cross, what say you?
I am 100% in for vaccine mandates, Mark. I think that is one of the only ways that we've actually seen any bit of compliance in terms of public health and public health awareness. We know that there are individuals across this country, sadly, on both sides of the aisle, but more stringent on the right, I'd argue, as well as anti-vaxxers and people who are just spreading disinformation and misinformation around vaccines, their effectiveness, and diminishing the move to eradicate COVID-19. We now know that there is this new variant, the Omicron variant. We don't know how many more new variants are to come, but in order to stop this thing at its heels, we have to get more people vaccinated. We have to ensure that folks don't get sick and are hospitalized and are dying. And this vaccine is extremely important. And I think that for New York, it is pivotal just because of the size of the city, because of the frequency in terms of travel there. I'm actually in the great state of Mississippi now. I had to transfer my own grandmother to a nursing home today. And Mississippi, it's all over the news. They have their first Omicron case in the state, and it was a traveler from the state of New York. So this is a really big deal.
Wow, Melik. Eric Adams is a new mayor. He's going to take office on January 1st. He has the opportunity to make a different choice. He could not keep the mandate in place. Should he keep the mandate in place or revoke it?
No, I do think that he should revoke the actual mandate, but continue the work that the federal government has been doing since this crisis, since this pandemic actually hit, to follow that sort of guidance. I think when you get into the thing of mandates for private sector employees, essentially just mandating what private employers are able to do, not the government, but private employers. And then you have 5-year-old kids who are now going to be forced to get the vaccine. I just think that that's a very different discussion than people who are maybe vaccine hesitant. And I think this push, if you will, because last year, what the discussion that we had is that there was a thing called natural immunity. Well, we've passed that number that they initially said that would get us to natural immunity, but we're not actually having those discussions. And so the consistency and talking about mandates and really kind of mocking and diminishing the opinions of those who are hesitant against the vaccine, I don't think that that type of messaging has been helpful for the overall vaccine debate.
Ameshia, there are people like Melik who are saying, look, we're not against the vaccine, but we're against mandates. The state shouldn't be dictating our health choices. Before, they had the option of getting tested every week. They had an alternative to getting the vaccine. What do you say to those people who say, look, I'm not an anti-vaxxer. I just don't think the state should be making that choice for me?
Well, now, at least in New York, the private sector will be making that choice and not the state. I think that at the end of the day, Americans have basically fallen back on their commitment to public health. This wouldn't have been an argument that we had 50, 60 years ago. This isn't the first time we've mandated a vaccine across this country. I think that as it relates to actually being able to protect our community, being able to protect elders, being able to protect even young people who have compromised immune systems, this is something that is extremely important and something we have to be vigilant about. America has enough vaccine 10 times over, where we have countries across Africa, we have countries across Central and South America who aren't able to get the first vaccine out, much less a booster. I think that we need to really understand the importance of vaccines, shake away from all of the rhetoric. And I don't think it's all anti-vax. Some of it is quite frankly just misinformation. But with that being said, there has to be a point where Americans come together and understand what the priorities are around public health, how we can get our economy back on track, how we can get our communities back on track. And a lot of that is wrapped around us getting this virus under control.
Melik, before we go, you said something that I was going to leave it alone, but I just can't. You said that you're against vaccine mandates for this vaccine, but you're not against vaccine mandates as such. In other words, there are some mandates you're fine with, just not this one. First of all, is that a fair characterization of what you said?
Yes.
So with all the people who have died, all the people in hospitals, why would you be okay? Or let me take a step back. What vaccines are you okay with the state mandating?
Well, I think those vaccines that have really been available for some time now. All of us, I'm sure, went through schools where we had to get either the chickenpox vaccine, the MMR, like the measles one. So
Polio.
All of these things have actually been in our system or our body politic or discourse for some time now. When you're talking about a vaccine that, despite the yeoman's work that the Trump administration did working with the private sector to get the vaccine into production, there are still questions about the vaccines that we just don't know. I participated in 2 clinical trials.
Like what?
So I know everything that goes into vaccine, research and everything.
What are the questions?
Even though I don't have
Malik, Malik, hold on. What are the questions? You said there are still lingering questions about the vaccine. Like what?
Well, this is with any vaccine, and not just a vaccine, any type of drug, any type of new drug. There are always questions about the side effects that we don't know. There's a reason why now, I think that was it aspirin? We're not finding out that, you know what, you're not supposed to actually take that if you're having, maybe experiencing a heart attack. These are things that we find out about drugs, not just vaccines, but we find out these things all the time. And for any type of drug, if you will, that's only been available for about a year now, obviously there are going to be questions that we have about it that will continue even years from now. That does not mean that we shouldn't be out encouraging others to get the vaccine, because as I said, even though I have those questions, I've been vaccinated myself. My family members have been vaccinated. But in the Black community, even here in Washington, D.C., between June and October, the end of October, there were, of the 50 COVID cases, the deaths that we've had here, 49 of the 50 were Black. 42 of the 49 were unvaccinated. So obviously there is an issue, and we should encourage people to get vaccinated because it's not there to prevent you from getting COVID. It's actually there to deal with any type of serious complications from getting it. So I think we should be able to have those type of
It's
discussions and not just throw everybody in the, well, you're just into, against vaccine box.
almost like you debate against yourself. Ameshia, I'm gonna give you the last word here. If he's saying that you should get it because it's important and we don't want people to die, but you shouldn't mandate it because we don't know what's in it. But we don't know, and he used aspirin as an example, although obviously we've been taking aspirin for many decades. And so by that logic, we'd have to wait 50 years before we take a COVID vaccine, or 60 years before we take a COVID vaccine. What do you say to Melik's argument here, which is, I think, that, yeah, we should take it. We should encourage people to take it, but we shouldn't mandate it because there's still questions about side effects.
Well, first and foremost, we do know what's in this vaccine. We've known what's in this vaccine for a very long time. And doctors have talked about it across social media. We've had a lot of vignettes speaking on it. And there are pamphlets that are given out as soon as you get the vaccine or if you're interested in the vaccine. So let's just squash that for a minute. But I do think that it's important that we address the vaccine hesitancy that is prominent within the Black community. And that has absolutely nothing to do with the right. There's just a lot of vaccine hesitancy. A lot of that, as you know, Mark, is from some of the past apprehensions around a lot of the medical community using the Black community as guinea pigs for various things. And I think that is one of the reasons why we see such hesitancy here, and that's a mountain to climb. But with that being said, we know of the importance of the COVID-19 vaccine. We know that the majority of side effects are extremely low ranking. Of course, your arm might be a little bit sore. I've had 2 shots plus the booster. My arm was a little sore, and that was all I got. For most people, there's that, possibly a low-grade fever, possibly a headache. That's in 98% of cases. And the majority of those is gone within 4 to 5 hours. So it's the same as any vaccine that you get. Those are very, very low-level side effects. For the most, you're not going to see anything long-term in the great majority of people. We know that. We've seen the tests. We've seen the trials. At the end of the day, whatever Nicki Minaj said about her cousin's balls is absolutely untrue. We know that women are not going to lose their fertility based on this vaccine. Actually, I've had friends get pregnant twice between taking the first vax and the second vax. So let's just stop right now with that.